Hi again, everybody. Thanks for joining me. Just wanted to say Happy New Year and check in with you all. This is our little talk about COVID. The pandemic is still with us, and wanted to talk about the exciting news of the vaccine, which is really giving us a lot of light. Hopefully, we're all still doing our due diligence and really wearing our masks, really still washing our hands and staying socially distant. I know the city of Chicago is still under some restrictions, and hopefully we are all following them so that we can be safe and keep our loved ones safe as well as our clients when we work with them. So that being said, we have this fabulous new vaccine that was introduced in December, a couple of them actually, and it is part of, our arsenal, our weapons against this pandemic, and just another thing to, help us fight this. So that being said, many of us have been offered and have received the COVID vaccine. I know that some people have not received it yet, maybe because they weren't able to when it was offered. And I think there's a few of you out there too that might be not sure about getting it, and maybe they're a little nervous. And I do want to talk about that just a little bit. So let's talk about the COVID virus versus the vaccine. I made a little slide for you, and just want to review it with you. The virus versus the vaccine, right? So what is it? The virus is an infectious agent that invades living cells and reproduces. So it gets in your body and does quite a bit of damage. The vaccine is no virus. It contains no virus at all. It is a man-made copy of the outer spiky part of the virus. So again, you are not receiving any part of a virus when you get the vaccine. What are the side effects? For the virus, it's fever, cough, sore throat, difficulty breathing, headache, nausea, diarrhea, loss of taste, loss of smell, death, the ultimate side effect, right? Unfortunately, you may or have heard of or know someone that has passed away due to COVID. And this is something we really, we're trying to, make sure we get through this and have as least amount of fatalities as possible. Side effects for the vaccine, if you're following along, is possible fever, some achiness, soreness at the shoulder site where you got the vaccine injection, and possibly a headache. How long will these side effects last? They can last days, weeks, and months for people who get the virus. You may or may not have heard of a term called long haulers. These are people that were sick with the virus and are still going through a lot of really difficult fatigue, meaning they're so exhausted, they're still having difficulty breathing. So we have no idea how long they're going to be living with these side effects. For the vaccine, how long would these side effects last? I've only heard about a day or two. Some people don't have any side effects, which is fantastic. So that's the big difference between those. It goes away after a short amount of time. And then finally, how many people have died in the US? From COVID, 4,103 died in just the past 24 hours. So that's a big number. Almost 400,000 people in the US have died from COVID. This is versus the vaccine, which is zero deaths out of 10 million vaccinated. So your chances are better with the vaccine. And, I think that for anyone who is really scared of it, you should be more scared of getting the virus. And the virus is still out there. It's very contagious still. So, things to think about. So the next slide is just talking a little bit about myth versus fact. The myth is that it changes your DNA. The vaccine does. It doesn't. It's a messenger RNA vaccine. There's some of the first COVID-19 vaccines authorized for use in the US. The mRNA from the vaccine never enters the nucleus of the cell and does not affect or interact with a person's DNA. The myth that the vaccine can cause you to get COVID-19, messenger RNA vaccines do not contain a live virus. Like I said before, they do not carry a risk of causing the disease. Now, I do want to mention that with the vaccine, with the first dose, it's about 50% effective. So there is still that 50% chance you could get COVID from, being out or not wearing a mask or, however you got it transmitted to you. So there's always still a chance to get it, especially if you haven't had the second dose yet, but it does not cause you to have a positive test result, the vaccine. And then the myth of the vaccine is too new to be safe. It's true that it's new, but it's been well tested. Hundreds and thousands of people have been testing this vaccine since they started looking at it back in the early summer of last year. So, it's been authorized for use in the US. It goes through a very stringent peer review, which means a lot of scientists and a lot of doctors look at all of the data before they okay it for use in the US citizens. So it's very safe. And of course, I got my COVID vaccine. I want to tell you a little bit about it. Oh, look, there's my picture. I received my vaccine about a week and a half ago. It was a really simple process. I sat down, I wore a sleeveless shirt, which I highly recommend you do, and filled out my form. I sat down. The person gave me my vaccine. It was nothing, didn't feel a thing. And then I actually sat and waited 15 minutes to make sure I didn't have any kind of reactions. Everyone around me was really excited and happy, and I did not see any reactions at that time at all. I did, however, take some pain relief because I know that sometimes there's soreness in your arm where the injection is. So I went ahead and I took some just to make sure I was able to, not get too sore. I do recommend, if you do feel soreness, go ahead and take something for the pain, and go ahead and take it around the clock. So meaning if you take a Tylenol and it says take every 4 or 6 hours, go ahead and take it for at least a day, just to make sure that you're able to use your arm without it being too painful. And then of course the second dose will be given to me 3 weeks from the time of the first dose. Again, the first dose is up to 50% effective. The second dose, after, I want to say it's about a week or 2 weeks after the second dose, I'm up to 97% effective. It does not mean there's no chance of getting the virus, but there's a 3% chance only, and I will absolutely take those odds. So it's very important that you do accept taking the vaccine when you can. Many of us have taken it, as you can see from the pictures, and we're all very excited to be able to, let our clients know we're starting to get vaccinated. And as we all get vaccinated in the country, we'll start to see, less and less restrictions as time goes on. If you are not getting vaccinated, I want to find out why, I would love to chat with you. Please call me here at the office or send me an email. I think, you know, the more information I can help you with, I think the more you'll feel better about getting the vaccine. If you have specific questions about your health, always a great idea to call your doctor. I know a few of you have told me you're going to reach out to your doctor first before you get the vaccine. And I strongly encourage you to do so. The other point that I do want to make is that as we move forward and vaccines are going to be more readily available to everyone, we will really want all of our caregivers, all of our staff to be vaccinated. I think we will find that many places where we work with regards to healthcare, our clients, anywhere you work, will want you to be vaccinated in order to be in the community. I know that quite a few clients have asked if we were going to have our caregivers vaccinated, and I think that that will probably be a request moving forward after all the vaccines are available to everybody. So I strongly encourage you to get it. The more people get it, the more likely it is we will be able to see each other and maybe even hug each other and be with our loved ones. I'm very much looking forward to that day. So I hope you are too. And that kind of wraps it up for me. I am hoping to have a Zoom meeting next week, like a little town hall, about the same time, same day, Thursday afternoon. We'll send an invitation out. I want to be able to answer questions. So if you have specific questions, please email or call or talk to your care manager about what you're seeing today. If you have questions, we want to give you as much information as you need so that you can make a good decision about getting the vaccine, because it's really important. And I want to be able to see all of you and maybe hug you soon. So thank you again for joining me today. And I look forward to talking with you all very soon. Thanks.